Hello, my name is Sequoise Jones. I want to thank you for watching my head-to-toe assessment that I'll be doing for Maryville University. This is Jorday, and she's volunteered to be my patient for today. Before we started, I had her empty her bladder. I took a full set of vital signs, including height and weight. I checked her distant vision using a Snellen eye chart. I had her change into a gown, and I washed my hands. We'll begin our assessment with the head, the inspection of the head. I'm looking at the shape and contour of the head and skull. I'm looking at her skin for any dryness or any open areas. I'm looking at the alignment and placement of the eyes as well as the ears. I'm looking at the shape and contour of the nose. I'm looking at the mouth and the corners for any cracks or fissures. I'm looking at the smoothness of the neck. Now we'll move on to palpation of the scalp. So when I palpate the scalp, I'm palpating for any edema, any tenderness, any depression. I'm checking to make sure that the skin is moving freely in between my fingers, the distribution of the hair, and I'm also checking for alopecia to see if any hair moves easily. From there, I move on to palpating the facial bones, any tenderness. Okay. Then I move into palpating the sinuses, the frontal and the maxillary. And then I move into palpating the temporomandibular joint. Open your mouth for me. And move it from side to side. Good. Close it. I do not feel any popping or clicking, which is a normal finding. Now I will move on to the light sensation test. Will you let me know if you feel this equally on both sides? Now I'm going to have her put her face through some different movements. Can you wrinkle your forehead? Squeeze your eyes shut. Smile. Clench your teeth. Stick out your tongue. And puff out your cheeks. Okay. Now we'll move on to the assessment of the eyes. I'm looking at the distribution of the eyebrows. I'm looking at the eyelids. I'm looking for any edema or cholesterol buildup. I'm looking at the iris. I'm looking at the lens for any cloudiness. I'm looking at the conjunctiva. They should be pink and moist, which they are. Now I'm going to palpate the lacrimal apparatus. Any tenderness? Good. Now I'm going to move into testing the pupillary response. Can you look directly at my nose? I'm going to first check direct, and then consensual, then direct, and consensual. Good. Now we're going to do the cover and uncover test. Can you look at the Post-it note that I have on the wall? And without taking your eyes off of the Post-it note, I need you to cover your left eye. Uncover. And cover your right eye, still looking at the Post-it note. And uncover. Good. I did not notice any nystagmus or any jerking eye movements with that test. Now we're going to move into another test, the visual fields of gaze. You could follow my pen light, move it only your eyes and not your head. Okay. And with that test also, I did not notice any eye jerking movements or any involuntary eye movements with that one as well. Next, we'll move on to the assessment of the ears. I start off with inspecting the ears, noticing their placement, and then I'll palpate the auricle and then the pinna. Okay. And then I'll go on to performing the whisper test. I'm going to whisper a two-syllable word, and you can repeat that for me.
Baseball.
And now I will repeat the second word.
Grapefruit.
Okay. Now I'm going to perform the ring test. What I'm going to do is I'm going to strike the tuning fork and place it on the mastoid process, and I want you to let me know when you no longer hear the sound, and then I'll place it close to your ear, and you let me know when you no longer hear the sound. So she's shown that her air conduction is twice as long as bone conduction, which is a normal finding. Normally I would do this in both ears, but for the purpose of this video, I would only demonstrate this on one side. That concludes the assessment of the ears. Now we're going to move on to the nose. I start with inspection. I'm looking at the placement and the structure of the nose, and then I will inspect the internal structure. Can you hold your head up for me? I'm looking at the septum, looking for any deviations or any openings. I'm looking at the turbinates. I'm looking for any polyps. I'm looking at the hair distribution. I'm going to check for patency. Can you include the left ear for me? Breathe in deeply through your nose. Okay, good. And then the right side through your nose. Okay, good. Didn't notice any issues with that. Now we'll move on to the assessment of the mouth. Can you open your mouth wide for me? Okay. I'm looking at the gums. I'm looking for, make sure it's nice and pink. And I'm looking at her teeth. Open up wide. I'm looking at the buccal mucosa. Open up wide. I'm looking at the soft and hard palate. I'm looking at the teeth to make sure there aren't any missing teeth or any obvious cavities. I'm looking at the soft and hard palate. I'm looking at the tonsils. And can you lift your tongue up? Looking at the floor of the mouth. Stick your tongue out for me. To the left and to the right. Looking at the lateral sides. Can you say ah again for me? Making sure that the uvula rise midline. And open your mouth very, very wide. And positive gag reflex. Now I'll move on to the assessment of the neck. First I start off with the inspection. Make sure the neck is nice and smooth. Then I move on to assess that the trachea is midline and the thyroid. Now palpate the carotid arteries one at a time. And the thyroid, can you swallow for me? Good. Now go on and palpate the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submental, submandibular, superficial cervical chain, post-cervical chain, deep cervical, subclavicular, infraclavicular. Raise your arms up for me. And axillary. Sorry about that. Now I'm going to auscultate the carotid arteries using the bell of my stethoscope, one at a time. Can you hold your breath for me? Good. Exhale. Hold your breath for me. Good. I need you to breathe normally. No bruise noted. And at this point, I'll also look for any obvious jugular vein distension, which she doesn't have any. Now we'll move on to the assessment of the upper extremities. I'm going to inspect and palpate the shoulders and the arms for musculature and temperature. I'm looking at the skin for any open areas. I'm looking at the hair distribution. I'm looking at the nails and making sure that they're all intact. I'm looking for any presence of fungus or any clubbing. I'm going to ask you to perform some range of motion first and then against some resistance. Can you shrug your shoulders? Left ear to left shoulder, right ear to right shoulder, chin to chest, and then chin to the ceiling. Okay, shrug your shoulders. Okay. Left ear to left shoulder, right ear to right shoulder, chin to chest, and head to the ceiling. Okay, and your arms straight out. Can you lift your arms up? Good. Push your arms down. Okay, and push your arms out. Can you bring your arms forward? Okay, bring your arms back. Good. No issues with that. Now I'm going to move on to the cardiac assessment portion. I start off by inspecting the chest and the skin. This portion I would normally have the patient bare chest, but we're going to leave the gown on for this particular assessment. I'm looking for any obvious heaves or pulsations, and then I would move on to feeling the precardium for any lifts or pulsations, which there aren't any over the precardium, and then the apical impulse. And then I will auscultate over the heart sounds, first using the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and then mitral. And then I would make sure the room is very quiet. I would either have the patient lean forward or have them lay on their left side, change my stethoscope to the bell, and repeat the same sequence using the bell of my stethoscope, listening for S3, S4, or murmurs. Now I will move on to the anterior portion for respiratory. I will start off with inspection. This portion actually started in history and physical. I was checking to see if the patient became short of breath. Was she able to complete sentences without any shortness of breath? Was she able to ambulate? Did she have any shortness of breath with exertion? Did she use accessory muscles? Did she have any clubbing? Did she have any cyanosis or discoloration? Now I'll move on to check to see her, check for tactile fremitus. Lean back just a little bit. Okay. When I place my hands on your chest, if you can repeat the words 99.
99. 99. 99.
Good. I'm going to go on and percuss. I'm going to make sure to percuss between the intercostal spaces, not to percuss over any breast tissue. Now I'll go ahead and auscultate. If you can take a deep breath every time I touch you with the stethoscope. Good. Now I'll move on to assess the back, posterior portion of my respiratory assessment. If you could turn around for me. Under your gown. I'll start off this portion of the assessment with inspection. I'm looking at the skin for any open areas, any lesions, or any dryness. Looking at the complete inspiration and expiration to make sure that they're equal. Noting the thoracic configuration, anterior to posterior is 1 to 2. Then I will move it into expansion. At the 10th rib, you take Deep breath in and out for me.